Thank you, first of all, for joining us tonight on this community chat on healthy communities. My name is Maren Hill, and I'm a planner with Montgomery County Planning Department, and I'm going to be facilitating the discussion tonight. I'm also joined by Amy Lindsay, who is from the Planning Department as well, and Karen Tompkins from the Montgomery County Department of Health. Before we start, I'm just going to outline some of the kind of rules of engagement before Amy and Karen jump into their presentation, and then we open up the floor for discussion. I want to recognize that this is a difficult time that we're in right now, and just wanted to see how everyone's feeling. I know that we're all experiencing some challenges, some of them shared and common, and some of them really unique to ourselves and our situation. If you want to share anything about how you're feeling, feel free to drop a word in the chat or just take a breath and, pat yourself on the back for coming tonight. I know that for me, sometimes even just showing up can be a little exhausting right now. I know that Zoom might be a new technology for you. It definitely is for some of us. So if you have questions at any time, you can type them in the chat box and we'll try to answer them as quickly as possible. If you want to send us a private message in the chat window, which you can see chat at the bottom of your screen with the little voice bubble, you can actually change who you're sending it to, so you can select everyone, or if you just want to send it to me to answer, you can send it to Maren Hill. I wanted to let everyone know that this meeting will be recorded and posted on our website. It will also, which is www.thrivemontgomery.com, and all the chat conversations that are to everyone will also be saved and shared with planning staff who are working on the Thrive Montgomery 2050 update to the general plan. We're going to ask that people stay muted throughout the first part of the meeting, but if you have a question or a comment, you can raise your hand. You can do so by clicking on the participants icon at the bottom of the screen, or if you've joined by the phone, you can press *9 to raise your hand. When we call on you, you can unmute yourself by clicking the unmute at the bottom of your screen on the left-hand side. Or if you've joined by phone, by pressing *6. And don't worry, I'll recap this again right before we jump into the discussion. At any time, you can post comments, questions, thoughts, ideas in the chat box. And the chats will be visible to everyone who's participating tonight, unless you select a specific participant to send the chat to. We ask that you be respectful in your chats and your in the comments. Comments that use profane or offensive language will be dismissed. And then, like I said, Amy and Karen are going to give a brief presentation. And after that presentation, we'd really love to have an open discussion. Because even though Amy and Karen are presenting this information and sharing what they've learned over the years and through this process, they both said, we don't want to be the experts. We feel like we have a lot to learn. So we want it to be an open discussion, hear people's ideas and thoughts. And after the presentation, we'll come back and remind you about ways that you can participate. Okay, so thank you again for joining us tonight. I'm going to briefly introduce Karen and Amy. Karen Tompkins obtained a master's degree in public health from the Rollins School of Public Health at Emory University. She has over 19 years of experience in public health, working in public, nonprofit, and private sectors. Her past scope of activities include community engagement, program management, strategic planning, public health promotion, and social marketing. In 2014, Karen joined the Montgomery County Department of Health and Human Services and currently serves as a program manager supporting Healthy Montgomery and the Commission on Health. Amy has worked for 14 years for the Montgomery County Planning Department as a planner. She has a master's degree in landscape architecture from Morgan State University and became interested in health impacts of physical design through her studies. Her specific area of research is children's access to open space. Amy is the Planning Department's representative to the Healthy Montgomery Steering Committee and the chair of Health in All Places. work group. She lives in West Virginia with her 3 kids who might pop onto Zoom, no, and a sort of many animals. So this is who Amy and Karen are, and I will pass it off to Amy to start the presentation.
Good evening. Thank you for joining us. Can everyone hear me okay? Great. So welcome to the presentation on the community chat on healthy communities for Thrive Montgomery 2050. Once again, we're Amy Lindsay and Karen Tompkins. So what is Thrive Montgomery 2050? Just in a nutshell, it's Montgomery County's update to the general plan. It's a big picture document full of ideas, not detailed recommendations. It's focused on the future, hence the 2050, not tomorrow, but looking at longer term. And it will set the direction and work program for the next 30 years. So this is a big idea policy document, not a detailed go fix the potholes in my street kind of document. So just giving a little bit of background to explain why we're doing this. Montgomery County has changed a lot over the past few years since the last time the general plan was updated. So our region looks very different. Last update to the general plan, Washington, D.C. was really the job center. Now it's not. People commute in a number of different directions. We've had some major demographic shifts. We're a very diverse county. Our family sizes are smaller and our population is aging. Also, the world is not the same. I mean, look at us now having this public meeting over the internet. You know, could you have imagined that 15 years ago? Much less the last time the general plan was updated. We're also dealing with climate change. That's a major issue that has already starting. We're already seeing the impacts of climate change now. So our county is mostly built out. So this is not about a whole new county. This is about adapting to change and recognizing that change has happened since the last time we went through the general plan. So I mentioned the change in county demographics. They are pretty serious. On the left, you see a map that shows the predominant racial or ethnic groups in 1990 by census tract. And you see the darker blue is predominantly white population. Look at the change over to the 2016 census tract data. The yellow is no predominant group, so those are census tracts that are truly diverse, with no group greater than 50%. So you can see that the county looks like a very different place than it did back in 1990. We're also an increasingly older county. Here you can see the age shifts from 1990, 2016, and then projecting out to 2040. 1990, the population over 65 was only 10%. Fast forward to 2040, we're looking at greater than 20%. So that's a doubling in just 50 years. So that's a huge demographic shift. We also have a growing population that we're not meeting the needs of our residents, people that want to live here. And so that's causing, prices to rise. It's causing growth in outer further out suburbs. So this is definitely a real issue. But our county is mostly built out. We have a lot of area that is environmentally constrained. Then we have our agricultural reserve, which is also constrained. So we're looking at about 15% of land being developable, or being unconstrained. And this is a really interesting graphic because it shows how our current land use stacks up, with nearly 37% of the county being taken up with single family homes, and only 2.3% of the county in multifamily homes. So you can see that we're a mature county, but that doesn't mean that there can't be any changes. It just means that the proposals will look very different. So what are the key themes of the master plan? First, that we're looking at corridors development as being a major part of the future development. We're looking at services, and the communities are really designed around like a 15-minute walk. Active lifestyles, really increasing the focus on that. And one of the big ones is to stop planning for cars, but to plan for moving people instead. So, and you know, another one is embracing our diversity, seeing housing as a right and a value. So those are the key themes that we're looking at for this for the general plan. So our overall framework and vision include complete communities, which means that instead of communities being essentially one type of development, so a neighborhood is only single family homes of people making $125,000 to $150,000, that we have a mixture within neighborhoods, that we have neighborhoods located closer to workplaces, and as well as commercial and services, as well as the notion of vibrant corridors. So our corridors are a real opportunity for us to add different kinds of multimodal transportation and services, as well as using corridors, the concept of corridors, to connect our natural systems. So the three main pillars are economic health, community equity, and environmental resilience. And these are the 8 basic chapters or sections of Thrive Montgomery: complete communities, connectedness, diverse economy, safe and efficient travel, affordability and attainability, healthy and sustainable environment, diverse and adaptable growth, and design, arts, and culture. So from a health perspective, when you start thinking about health, not healthcare, we think about health as being a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So that's a much broader definition than thinking of health as being, you know, oh, I didn't break my leg, or something like that. I mean, that's kind of absurd, but it's a much broader way of looking at health. But where is health in Thrive? I just talked about the eight chapters, and health isn't in there. Well, that's because health is everywhere in Thrive. Health is woven through the document.
Okay, thank you, Amy. And just picking up on the concepts of health and thinking about health, whether as we plan out our future, whether we think about it or know it for sure, the decisions that we make will impact our health. And I think we can easily draw the connection between pedestrian safety and health, especially when we look at the news and the different headlines that we see about pedestrians being killed or injured in Montgomery County. And this is actually throughout the county: Gaithersburg, Chevy Chase, and Bethesda, Rockville Pike. So it is something that we can easily draw a line between pedestrian safety and health. And I know one thing I've noticed in general is just that even watching pedestrians going across the street in downtown Silver Spring or in DC, you know, pedestrians will go across several lanes of traffic, even though they have the walk sign, and not even look up. They're looking at their phones, they have their headphones on, and they will just walk across as if there's no possibility that a car is going to turn and hit them. So we know some of this has to do with pedestrians and users and automobiles, but it's also about the design of our environment. Maybe there needs to be more crosswalks and traffic signals, or not having enough sidewalks or enough lighting at night that contributes to pedestrian accidents. Next slide. What about transportation and health? I know that it's pretty common to think about automobile safety when it comes to health, but if you do not have reliable transportation, you will need to be in close proximity to the metro. Transportation is needed to get to work and to earn income. We all know that. And in our country, our insurance is tied to our employment. So a lot of times, if you don't have, if you're not employed, you're not going to have enough health insurance or have access to health insurance. We also need transportation to meet our basic needs of food, groceries, and social connectivity. Next slide. Well, here's one example of the importance of transportation in a small community. Tobytown is located in the western part of Montgomery County off of River Road. It's largely an African-American community founded in 1875 by freed slaves. Currently, there's about 60 residents. In 2017, prior to 2017, the closest bus stop was 3 miles away and the metro station 10 miles away. It's located in an area of the county with very low population density, very few employers, and minimal demand for transit service. Poor residents of the community did not have access to transportation until 2016, when County Council approved a ride-on bus service to the community after trying different things over the years. I think previously they had used some sort of a transportation voucher with cabs and a couple other different other alternatives. So residents who did not have transportation now have more access to those basic things that we need to live: employment, food, all those things that promote a healthy life. So we probably would not think about Tobytown when we think about the Potomac region of Montgomery County. However, these communities exist in the county. Next slide. Schools and education. We all know that there are many aspects of health, of safety and wellness in children in the school system. We're concerned about how they travel back and forth to school, safe routes to school, concerned about school shootings, proper immunization, hunger, illegal substance use, alcohol use and abuse. Over a year ago, our county health officer, Dr. Gales, issued a health advisory about the dangers of vaping in youth. Did you know that 22 of the 26 vape shops are within half of a mile of a school? It's another reminder that we have to give careful consideration about the location and type of businesses that are allowed in the community. And by the way, County Council has proposed 4 pieces of legislation to address the location of vape shops, tobacco shops, in close proximity to schools. Next slide. So this root cause map, I like to kind of go through this exercise because I think it's very informative. It was developed by the American Public Health Association and Public Health Institute. And don't worry, we're not going to go through the entire map. Looks like a lot. We're looking at the issue of obesity and being overweight. And I think this is something everybody can find relatable. We know that there's many contributing factors to being overweight and obese. And by the way, we can add COVID to that list. The struggle regarding weight is often seen as has to do with a person's individual fault, their lack of motivation, lack of willpower, but it's not that simple. Next slide. So let's say that one cause of obesity is a result of calories. Too few calories out and too many calories in. Looking more closely at taking in too many calories, why are we taking in too many calories? It could be a lack of nutrition knowledge, access to nutritionally poor foods, and lack of access to healthy foods. But again, we have to ask why. Why is that the case? Too many fast food restaurants, limited transportation, no farmers markets nearby, or full service grocery stores. And as you ask these questions, we can see that there are other factors at play. Place matters, and if you have more money, you have more choices as to where you live and can live in an environment that is more supportive of health. So what I like about this exercise is that you can pick any health issue or any community problem and go through this exercise. We can use this to determine what decisions are being made outside of an individual that impacts their health and well-being. In summary, decision makers, not just policymakers and funders, but also programmatic individuals such as myself and Amy, we have to do our part to ensure that health is being considered as we do our work. Community members also have a role to play in being vocal and engaging in the process when opportunities come up, not only advocating for the needs of the community, but the larger community around them.
So just to further draw the connection between outside factors and health, created this this graph that shows the length of life by quartile in Montgomery County, cross-referenced by the income by quartile. And you can see that in the fourth quartile, there's a very strong connection between length of life and income. I mean, they're very closely related. So it's not just someone ate too many cheeseburgers. I mean, the consequences are very clear that there is a connection between economy and health. So what can Thrive do to change that? I mean, this is a planning document. So, and I did talk about the fact that health was woven all the way through, though it may not be mentioned by name. So I'm not going to read all of these, but here's some of the goals, policies, and actions that I picked out of the document that I thought really reflected the impacts that this general plan can have on your health indirectly. It's not speaking to healthcare, but it is talking about ways that will influence health. For example, down here at the bottom, eliminate all transportation-related fatalities and severe injuries. Provide a transportation system that is safe for everyone. Making certain that we're addressing equity. That has a lot to do with health. Here are more. So talking about housing, build or retrofit housing that meets the needs of older adults to enable them to age in place, downsize, choose rental or ownership, or find housing with the appropriate level of services. when you think about how much of your income is spent on housing, you can see that the connection between housing and health is really very clear. You know, accessible design, creating land use policies that allow us to be able to be flexible and adapt to changes in the future. But then there are some goals, policies, and actions that are very specific to health. And that really is a first for Montgomery County. So the big one is improve health and well-being for all Montgomery County residents and address the health disparities that currently exist. Provide all residents with safe, convenient access to affordable, healthy foods. Talking about climate change. We know that with climate change, we anticipate seeing more health and healthcare challenges. Creating opportunities for physical activity and building that into community design, as well as retrofitting existing communities that are battling chronic health conditions and prioritize them for access to physical activity opportunities. So next steps in this process. We're currently here. We just presented the draft vision, goals, policies, and actions to the planning board last week. And we anticipate council review and approval in April of 2021. You can see the steps we've got going through. So we're still, you know, early in the process. And there's still a lot of opportunities for participation by the community. We want to hear from all members of the community, you know, those that we don't often work with. If you read the document and you don't think we understand an issue or think we've missed something, please let us know. We're looking for feedback on our policy proposals. And of course, you can always testify at a planning board hearing. And to find out a lot more about this, you can go to thrivemontgomery.com, and that's our website that has complete information on the entire Thrive Montgomery process.
Thank you, Amy and Karen, for that presentation, and we'll drop some of those links into the chat box for those who want to check out the website. The PowerPoint presentation, as well as the recording of this event, will also be on our website. So if you want to check out individual slides or review some of those policies and actions in more detail, you'll be able to do so at the website. So now we're at the point where we'd love to open it up for discussion, to hear from all of you what your ideas are, more questions, thoughts, really anything you'd like to share. And just to remind everyone that you can share questions and comments in the chat box, and you do that by finding the chat at the bottom center of your screen. Or you can verbally let us know what you're thinking, and you can do that by raising your hand, which is if you click on the participants icon at the bottom and then scroll to the bottom of the participants, you'll see an option to raise your hand, and we'll call on you. If you are on the phone, if you've joined by phone, you can press *9 to raise your hand and *6 to unmute yourself. So we will open it up for discussion, and while you guys are mulling all of this over, Karen and Amy, I'd like to ask a question. So obviously this is a long-term planning document, you know, like 2050, so 30 years from now, we're really setting the scene, but right now we're living in probably one of the largest, if not the largest, health crisis of many of our lives in this pandemic. How do you see this plan responding to COVID-19? Or do you think that the plan or elements of the plan are going to be revisited due to the pandemic?
Well, I think the plan actually does a really good job of responding to COVID, partly because we're working on it through this. So things like unequal access to the internet is clearly on everyone's mind. Also the inequity, while we're working at home, some of us are at least, there's a whole lot of people that aren't able to do their jobs from home. So I think it really has brought the equity issue to the forefront. I think it is responding well by, the whole idea of complete communities, having a community that has open space integrated into it, definitely responds to the challenges of COVID right now. The same with making certain that people have access to healthy food, so that we're not, that some people aren't having to, take really long bus rides to get to a full service grocery store, and really looking at what are our land use policies that might be contributing to that, in terms of zoning and things like that. So I do think this plan is responding to it, though clearly we're not out of it yet. So there may be other challenges that it needs to address in the future. What do you think, Karen?
So I think Karen's actually having a little bit of technical difficulties.
Okay.
That's why she's keeping that amazing stoic face right there. So while she checks in on technology, I just wanted to pass along the suggestion that we got from Michelle. Michelle was saying that she recommends that Thrive be presented to minority initiatives and programs in the county. Can you talk, Amy, a little bit about how Thrive, how we've been working with different agencies or different partners and different communities throughout the process?
Sure. We've done a fair amount of outreach. I'm not going to say that we've talked with everyone. Clearly we haven't, but different work groups have been reaching out to different agencies and getting their feedback. I know, for example, the group working on safe and efficient travel has been working very closely with DOT, and a number of groups have had stakeholder meetings. We've gone, out to the communities, anyone that we've been able to reach out to. I know that there was an outreach effort to the faith-based community, so that we're hearing from people that we might not always hear from.
Can you guys hear me?
Yes, we can, Karen.
Yes. So for example, I spoke with the Asian American Health Initiative, and heard some perspectives on multi-generational living that I hadn't heard before. So I agree, it's very important that we hear from as many voices and as diverse voices as we possibly can.
Karen, did you want to hop in and add something to either of these questions or comments that have been posed? Oh, I think she is restarting. That is part of the fun of virtual meetings, is that people can disappear and come back on. So we'll keep plugging away and wait for Karen to hop back on the call. Amy, I'm just going to keep directing questions at you then.
Sure.
One question that comes from Jane Lyons is about food deserts. So she says, how can Thrive address food deserts, especially access to healthy foods throughout the county?
So Thrive itself has the goal of providing healthy food and has actions that point us in the direction. And so one of them would be, to first look at the guidance that we already have, but also because there is a food security plan, so we're not duplicating effort. But also to look at food deserts and look at our zoning ordinance and regulations, see if there are any barriers. For example, grocery stores often have very specific requirements. Wegmans will only come if you guarantee them X, Y, and Z, right? Different grocery stores want their parking a certain way. And so looking for barriers for that are preventing access to healthy food. So that's one thing. Looking at opportunities for, I know community gardens are not they're not the solution for everything, because, quite frankly, in order to garden, you have to have time. And one thing that often does happen when you're dealing with families, you might end up with a family with multiple children, both parents are working. If you end up with long commutes, you don't have a lot of time. So a community garden might not solve your problems, but if we can start to look at where we're really missing opportunities, even if it's for helping create a farmer's market, so that maybe we aren't able to get you a grocery store, but maybe we're able to get you something once a week. That's a possibility. And on the flip side, it's looking at concentrations of fast food. I mean, you have the problem of not having access to good food, but having too much access to bad food. So it's looking at both of those situations. And there's also language in the Thrive goals that talks about helping bolster our ag reserve. Right now, a lot of the ag reserve is commodity growing. So what changes do we need to make to enable table crops to be grown? Is it that the cost of land is so expensive that and the price of food, that it just doesn't work out economically? That's the thing, is that this is not directing a solution. It's kind of directing that a change needs to be made, something needs to be studied, and really directing sort of an attack on the problem, not directing the solution.
And Amy, I'm back on.
Yay.
I had to log out and log back in. I'm back. And I think related to this and to the first part of the question that we started with, right now, we're experiencing a lot of turbulence in terms of culturally. And I think that we would be missing out on this opportunity to really listen to what people are saying, because we often feel like we need to do community engagement. We have these canned activities to reach the community, but they're speaking a lot right now. Communities are saying a lot. And I think that we would be missing out an opportunity if we were not really paying attention to what's being said, because probably everything that needs to be said is being said right now. And I know that just today, Deanna, who's our food security program manager, they just did an outreach effort in which they provided food to 700 families. And I think that that's a statement there. And they are probably hearing a lot from these families as they come up and pick up food, or just this whole process of making sure that they have what they need. A lot is being heard. Whether or not we're really capturing it is a whole nother story, but I think it's something for us to think about as we go about doing our work. We don't have to do these separate events to get information when there's so much information right now being said.
I think that that's an excellent point, that we often do outreach in one particular way, and you know, this is a topic that was very important prior to everything going on. Prior to COVID, we were talking then about changing outreach and making certain we hear from everyone. And I think it's clear that we need to change the way we're reaching out to the communities, and making certain we're hearing from people.
Mm-hmm.
One thing I think that's really clear that you've both mentioned in your presentations is this idea of health in all policies, and health kind of running throughout everything. And you mentioned the environment and the built environment, land use, as well as transportation, among other things. And I'd love to hear about how that work is being implemented or discussed. And I think you guys have worked together as well, and you work in two different agencies, and there are always jokes about silos and different agencies having trouble communicating. But can you talk to us about how that health work is kind of transcending all of these different topic areas?
Well, just for a little bit of background information, so health in all policies was one of the 3 priorities that came out of our last Healthy Montgomery needs assessment, which is also the needs assessment that's done for the county. And that was done in 2015 to 2016. The report came out in 2016. After that, the Healthy Montgomery Steering Committee had a priority setting process and decided that health in all policies would be their top priority, followed by behavioral health and chronic diseases. And Amy, as a member of our steering committee, I provide program support to Healthy Montgomery. And we started off with the Health in All Policies work group. So that work group, we met quite a bit the first couple of years. And I think one of the things we struggled with is keeping a work group going when you don't have, like, I guess, like the county executive saying, you must do this. We were also in a transitional phase in terms of electing new county council or county executive. And so there was reluctance in terms of moving forward with some of the ideas, so pretty much me and Amy and a couple other people were like, well, we're gonna do something anyway. So we've pretty much been continuing to work on it, even though the work group has not met on a regular basis in quite some time. We just continue to work together in different initiatives. And then we also have done presentations we did a presentation to the county department agency leaders across the county about health and all policies. I've sat on the state HIAP work group. So we've done a number of different things, but I think what we're doing right now is just figuring out how do we incorporate things in a practical way, the general plan being one of them, but then also following up with increasing awareness about health and all policies in a practical way for staff. Because I don't think most staff feels like they're necessarily decision makers, although, if you're handling any kind of applications coming through the county, just think about all the processes and contracts and all that. You are a decision maker. Whenever we're holding meetings, are we holding meetings at a time that we can that people will actually come? Are the meetings being held that's most comfortable for staff? So there are a number of things that we can do as staff to support health in all policies. So it's moving beyond the general, okay, here's what health in all policies is, and doing presentations to really doing practical application. And I think the general plan is one example of that. And I don't know, Amy, did you want to add to that?
Sure. Part of drilling down into further into policies and actions, sort of the next step is making certain that you're considering health when creating policies, making decisions. And from a planning perspective, that would mean creating a metric, an instrument that you would use when making planning decisions. So for example, you know, if a master plan was going forward, that it include an analysis of actual health issues and really respond to them. We found, sort of working offline from the Veers Mill corridor master plan, that, you know, with the help of Health and Human Services, looking at data from residents in that corridor, that we saw exactly what we would expect to. People identified that they weren't getting out and exercising, they weren't getting to the local park because the road actually served as a barrier. And so that was, you know, self-reported data, but it was in comparison to other self-reported data. So that was really important to see that what we saw as planners on the ground was what the people experiencing in their lived lives, that they were really seeing the exact same thing. So I think going through some of those exercises with every master plan and every development project to not only make certain we're addressing equity questions, but also health questions, so that, for example, when you're locating a library or any other facility, that you're really looking at who's getting, you know, are we serving underserved communities? Are we really doing a good job in making certain that everyone in the county has the same sort of access and the same opportunities?
I'd love to draw it back. We've obviously talked a lot about physical health, but both of you throughout your answers have also touched on emotional and mental health. And I'd love to hear about how this plan is kind of bringing some of those things together, at least touching on some of those elements, especially when we are, I think right now, living, as Karen mentioned, in such a stressful time for multiple different reasons. But how do you think this plan touches on kind of the non-physical aspects of health, or does it, and should it?
Well, it very much does. I mean, a lot of, you know, in terms of mental health, your access to green space, your tree cover, actually measurably shows up as an impact on your mental health. You know, a lot of us just think that, oh, I just feel better when I go for a walk in the forest. No, they've done studies and have shown that it's actually true. It's not in your head. You really do feel better. You feel better emotionally, you feel better physically. So that's a big one. I also think that the emphasis on community building, that's huge. And that has, you know, that's not a feel-good thing. That is an actual major health issue. you know, they've done studies and have seen that there's a real increase in mortality during major weather events in communities where people aren't connected to each other, even if they might be physically next to each other. The fact that they're not socially connected. We know that suicide is on the rise, that social cohesion is important with things like even the opioid epidemic. So I think the plan really does get at many of these issues without saying, and to make, you know, us a more healthy county, we're proposing to do X. So that the health is really woven through, you know, in terms of design, in terms of emphasizing culture so that everyone feels welcome, everyone feels like this is home, as well as making certain that people have affordable places to live so they have money left over in order to pay for transportation, healthy food. I think the plan does a really good job of addressing that.
The other thing I'd like to add too is that one of the things we're working on with Amy is from the public health perspective is providing background research and documentation for the things that are in the plan specific to health. So, you know, what are some of the national standards and guidelines specific to the ideas that are woven into the plan? Because I think that's something that that it's not necessarily for the public, but it is for people who are programmatic decision makers, you know, policy people, to see this is supporting why this is in the plan. And I think the other point that I'd like to make is that, you know, after this plan is adopted, then we need to make the plan live. You know, I think there's been too many plans and that have been put in place that it's done and it's like, okay, we're finished, but that's where we really start. It's like implementing, making sure that that it lives on, and that, you know, the plan is being followed and it's incorporated into throughout our decisions and practices.
And we'll be working on the implementation chapter next. So that's good, because we are looking at, you know, while this is a big picture plan, we know that we have to work with our fellow county agencies and as well as community groups to find a way forward. Just getting back to what Karen was talking about in terms of the studies and how they really reinforce recommendations. Chicago has a very strong requirements for requiring green roofs in their development, and you know, a lot of developers complain about that because a green roof is more expensive. You have to, you know, do your engineering in order to handle that extra weight, and they complain about the maintenance, and you know, there's often a lot of issues. But why Chicago did that was not for the reasons you would think. Sure, green roofs help with stormwater, right? They, you know, it's not full. It won't fully fix your stormwater issues, but what it really came down to was air quality. And Chicago studied it and found that the number of days saved, sick days that saved from asthma or asthma-related illnesses, that the green roofs did so much for their air quality by filtering out the particulate matter from the air, that they more than paid for themselves. The cost-benefit analysis showed that the green roofs were really worth it. And so they have a complete program on this because You know, they're able to, people aren't having to stay home with children nearly as much that are sick with asthma. So I think it's really important that we do look at the data.
Well, Amy and Karen, thank you so much. That was interesting. And I think that there is so much information that hopefully people will be able to get in touch with either of you to learn more. I'm also going to drop a little bit a link to our website if people want to learn more. And some other ways to get a hold of us by email or by phone. But I want to thank you guys for the presentation and for the discussion, and everyone for showing up. I liked Amy's little teaser that now soon we're going to be working on the implementation section because it segues great into this. We're having a series of these community chats on different topics. So throughout the month of June, if you go to thrivemontgomery.com, you'll be able to find what our other chats are. We're also going to have other opportunities for people to continue to speak with us, give us ideas and feedback. One of those opportunities will be in September when we present to the planning board our draft, our just draft of the entire plan. So the community members are welcome to testify or send testimony in, but there'll be some other opportunities. So we hope that you stay in touch and look out for it. And it looks like we just got one question, which hopefully we'll be able to send an answer to you, Michelle. She says that what concerns me from a health perspective is geography driving density. In Baltimore, the difference of a few miles, Roland Park, predominantly white and upscale versus Sandtown, where Freddie Gray was shot, has a huge difference in health outcomes and mortality. And I think these are the types of
Okay, apparently we've had some technical difficulties. Anyway, we will be getting back to you, Michelle, because that's a really excellent point. And one of the things that you'll see, I hope you go look at the whole document, because when you look through the affordability and attainability section, you'll see that it talks about mixing incomes, mixing types of housing, so that we get away from that, because you're right. Right now, we do have we have health disparities that are geographic. So we will be looking at that. Thank you so much for that comment. Anyway, thank you all for joining us. We really appreciate it. Have a great evening.
Right. Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you.